Good morning and welcome to Days of Learning podcast. I'm your host, David Nelson, and it is so good to have CV academics joining us today. I am joined by my good friends, Patricia Linnaeus, and Patricia is a respected leader in the healthcare industry, providing strategic counsel and working creatively with her clients and peers. Throughout her career, she has created solutions, helping people to live well. We're also joined by Jeffrey Veenhuis. Jeffrey brings more than 3 decades of sales, marketing, strategic business development, leadership experience to the technology, health, and life science industries. Jeffrey is currently president and CEO of Surfacide Manufacturing, a manufacturer of global provider of leading UV-C disinfection systems that he formed in 2013. We are also joined by Karen Barker, the content lead team member at CVA Foundation. Karen is a respected leader in education with over 3 decades of progressive experience as a staff education coordinator, community college educator, and paramedic program director. Karen has a doctorate of education with a concentration in education, leadership, and change. And finally, but certainly not last, we are joined by Dr. Christopher Simmons. Dr. Simmons is a clinical professor at Marquette University in the Physical Therapy and Exercise Science program, and he has previously been on the Days of Learning podcast. Whew. Good morning, everybody.
Good morning.
Good morning, David.
I'm so glad that you all could join us here to talk about the future of healthcare and the future of healthcare education. I want to start with a simple question. Patricia, how did this all begin?
It all began with 2 neuroradiologists from the Medical College of Wisconsin who had an idea and a concept of what the students are struggling with and what they're trying to find as resources to find their way in healthcare career paths. That's the beginning of the story.
And Karen, I want to bring you in because, when we had the pre-show, Patricia says that you have done Life Flight and you've done a variety of things in your career, your long career of nursing. How did you get involved with CV academics? And wait, got to tell us about Life Flight and flying on helicopters.
So I was the director of clinical services for Flight for Life here in Wisconsin for a short time. But my career did not involve like flying on the helicopters. My career in that particular venue was as a director of clinical services, involved with the physicians from the medical college, doing all the training and education for the staff and all the flight nurses and flight paramedics.
But when we think of healthcare education, and I want to stay with this, Karen, we often don't think of things like nurses and physicians having to fly in helicopters, right? We think of clinical places and ORs and such, but the idea of healthcare education really is varied from operating room to operating in a helicopter. Is that correct?
That is correct.
Right on. And Jeffrey, talk a little bit I want to hear a little bit about your work because I hear that you are quite busy during this pandemic. Talk a little bit about your industry as well as how you were involved with CV academics.
Yeah, thanks. So my background is medical device, medical technology. I've been involved with one of the kind of leading big company innovators in that space for a number of years. Medtronic, and recently over the last 5 or 6 years, we started manufacturing a unique and innovative solution that delivers UVC energy to disinfect environments. And primarily we started in the healthcare space, dealing with hospitals. We make operating rooms, critical care areas like ICUs or patient rooms safer from one patient to the other. And now amidst the pandemic, of course, the whole world is concerned with transmission risk of the environment. And so we're now disinfecting spaces like sets and stages and the Space Needle and sports teams and other venues, as well as really focusing on those major COVID centers and keeping the staff safe where they're exposed day to day and keeping those frontline workers safe, as well as the patients that have to go to a hospital for care.
So you're really in a unique position where you're in a manufacturing and a R&D, a research and discovery operation, but there really is a role for healthcare education in environments like what you are just described. Is that correct?
Absolutely, and that's how I came to CVA and the AMPAP. Was a acquaintance and associate of Patricia's and others. And in neurosurgery and orthopedics, in my past device background, a lot of what we did is educate healthcare, both support staff as well as physicians treating patients around the technology. And even today, we get to do that with infectious disease, infection preventionist, infection control. But a big part of the healthcare space is leading innovative companies that then can help deliver the knowledge to the workers and the leading physicians and staff workers to apply that to help make healthcare better. And so that's been my career for a number of years. And I've been fortunate enough to as well travel the world to places on medical missions like Haiti and other places that are developing world, and making and offering information, experiences, and digital learning wherever that child or kid is, and developing them and making them better. That's who doesn't want to get involved with something like that.
You know, I'm going to bring, it's a really good, I made a note of it to mention this idea of medical missions, because it's something that myself and Dr. Simmons know a bit about. Christopher, it's good to have you back on Days of Learning podcast. Can you talk about, because I know you as an educator, all right, and as a community engaged researcher, can you talk a bit about how this all fits in with this concept of CV academics?
Absolutely. So I've worked with you, David, for going on a decade and a half, and with Patricia nearly that same amount of time. And we've done a variety of different things in Milwaukee and southeastern Wisconsin, specifically focused on educational opportunity, access, and equity in the education space. And so where I come into this is I've worked with entities like Milwaukee Public Schools, Divine Savior Holy Angels schools, and then community partners like United Neighborhood Centers in Milwaukee and Milwaukee Boys and Girls Club, to provide opportunity and to provide supports and build capacity for equity for specifically under-resourced students, schools, and neighborhoods, to be able to get the same opportunities for not only academic but physical wellness as some of the places where we see that are better resourced. So when I started speaking to Patricia about this, I thought that there was opportunity, specifically on the level of the foundation advisor, which is where I sit, to think about how it would look to try and democratize access to STEAM education, to educational opportunities. And this becomes really crucial in a space where this is a monetization game for many. And I think that this is what makes CV academics so different, is that there are a lot of places that will allow you to get certification, get access to exams and other things, but don't necessarily think about what that means for people who don't have the resources and the access. And CV is doing that. And that's really important.
Chris, you mentioned, I want to stay with this at this time, you mentioned equity and democratization. Is not this space already equal? Doesn't everybody have access to this around the country?
Well, I'll use myself as an anecdotal example. I have 2 high school children, and by the time my high school children get to the point where they actually take their ACT exams, they'll have had 8 opportunities to take them at the school district that they live in. For a lot of kids at MPS, they might have only taken it once prior. So when we think about this process, we start on an uneven playing field. And when we start on an uneven playing field, one of the things that I hope from this CV Academics partnership, which is so promising, is that we gain opportunity and we provide or remove barriers for students that might not otherwise have access, to get access to the materials, the resources, and the connections they need to be successful, whether it be getting to college, getting into that first job, getting to medical school, or other.
Can I add to that, David? Maybe?
Please do, Jeffrey. Add, please.
I would say with the pandemic, one of the great things that we're trying to do is provide peer-to-peer or hands-on learning and mentorships. It's simply unsafe or unable to be done in a lot of the world today. And so, while maybe some students have that access and opportunity that others wouldn't have, what we're trying to do is give them all access to that safely and digitally. So they can connect to a community and they can get access to leaders like Dr. Chris, and wherever they are, they can get that peer-to-peer encounter via AMP and CVA that isn't available. And many kids in rural Wisconsin or in the inner city in Milwaukee would never know how to begin to do that. And we can be a bridge to make those connections.
And
Thank
I'll
you.
add to that, if I could, is that we also have it available to all students. Again, we have a scholarship program. So if there is a financial barrier for students, we have a scholarship program that they can actually apply to have that financial barrier taken away.
Patricia, I want to stay with this because I love what I'm hearing here. And I love the idea of equity and democracy of these resources. We were talking before we came on today, and we were talking about the idea of virtual shadowing. I'm old enough to say that's a new concept even for me. But I want you to talk a little bit, Patricia, about the idea of the vision of
Sure.
CV academics, please. Could you tell us about that, the bigger picture?
Sure, absolutely. It's really the vision, again, is to strengthen our communities and really to strengthen our students having all backgrounds of any type and bring them to the paths and the career paths that they're looking for. Healthcare is our beginning point for our disciplines. We're also going to be adding other programs and other disciplines. So we have in the bank or the queue right now is for engineering and legal and business to follow as programs. So it's again, bringing engaging career opportunities and resources to all students of all backgrounds, wherever they are, whether it is rural, whether it is urban, but bringing those real world experiences, and to Jeffrey's point, is to bring that to the students safely.
You know, Karen, I want to ask you, because of all of your experience in education and your content experience, can you tell us what comes to mind when you think of healthcare education? Can you speak into that, please?
Sure. The first thing that comes to mind for healthcare education especially is trying to develop a rich learning environment for students that's both culturally responsive and provides opportunities for students to really go beyond what they would see in a general setting. So we want them to wonder and to discover. We want them to learn to think critically and deeply, and we want them to develop their identity and to develop their social and emotional skills and to have a meaningful experience that's engaging. So that is first and foremost very important. But I think the other thing that comes to mind with health education is that we know that we are living in the future of healthcare that's really being driven, kind of to Jeffrey's point, by digital transformation. So not only are we needing to train competent medical professionals, but we also need them to be trained to be competent with technology. So that adds a whole different level of training and education for our healthcare workers.
You know, can you give us, I'd like an example, because you gave us a lot in that space around the bigger picture, but can you drill down to something that people can wrap their arms around? Give us an example of something in this space that you're going to go, this is going to blow you guys away.
Sure. So like from the digital transformation with healthcare, we already know, I'll touch on three things. So the ones that come to mind are artificial intelligence, virtual reality, and 3D printing. And some of those have already been brought up here in this discussion. But for example, we know artificial intelligence has the potential to redesign our healthcare system completely. We already know that artificial intelligent algorithms are currently being used to mine medical records and design treatment plans faster than most medical professionals can do. One of the things that comes to mind for me, because it's Breast Cancer Awareness Month, is Google's DeepMind. I don't know if you're familiar with that, but it's an artificial intelligence program that was developed for breast cancer analysis. And that algorithm outperformed all human radiologists on pre-selected data to identify breast cancer by 11.5%. So that's phenomenal. Virtual reality, I was talking about that earlier, is being used to train future surgeons and actual surgeons to practice operations. And there was actually a study in the Harvard Business Review just recently that showed that virtual reality trained surgeons had a 230% boost in their overall performance compared to those surgeons who are traditionally trained. And that study, which I think was very impressive, that study went on to say that virtual reality trained surgeons were much faster and more accurate in performing surgical procedures. The other one that comes to mind is 3D printing. That was brought up just a little bit ago. 3D printers. There was a study out of New York back in November of 2019, and they developed 3D print living skin along with the blood vessels. That really hit home to me because, as a registered nurse, and especially with critical care experience and EMS experience, the development of that technology was really crucial for skin grafting for burn patients. So it's just phenomenal when you think about the digital transformation that's occurring. And again, for our next generation healthcare, we need to be focused on academia for sure, but we also need to have that focus on technology because that's what's going to carry them through.
So I did a little lookup, and this won't surprise any of you, but it absolutely blew me away. According to CMS, the U.S. healthcare spending grew 4.6% in 2018, which is the latest data. And that equals $3.6 trillion with a T. And that is $11,172 per person. This is big. And I really want to speak into, I'd like to have each of you, and I'm going to start with Dr. Simmons, really how big is this? And I know your world of research and you're in the physical therapy world. How big is something of what we're talking about here?
I don't want to sound like I'm overstating it, but it's everything. When we think about this, access to healthcare costs are foundational problems that will crumble our system if they're not addressed, and not addressed systematically through technology, through innovation, and through a real push for equity. Because when we think of $11,000 and we think about that in simple terms, that may be near family income in some spaces at the poverty line in America. So when we're talking about that much money, and we're talking about that much money for healthcare, something needs to change immediately. So if we can't get a control on those costs, if we can't get easier access, and one of the things I like about this and this delivery of technology, what we haven't spoken at all about in this group, is the idea of preventative healthcare and medicine that can be done by a technology, that can be done in a way that doesn't require multiple visits to multiple clinics, to multiple venues, redundant healthcare providers. This is novel, and this is something that's going to change us. Yeah, I think that we can be at the forefront of that in doing this, not only from an education perspective, but in shaping future practitioners so that they'll understand how to use this technology to offset those costs and to gain access for others.
Thank you, Chris. We're going to get onto that prevention in a moment. Thank you for bringing it up, foreshadowing to what we're going to go. Patricia, how big is this? I really want to hear it from you as to how big you think this is based upon that almost $12,000 per person around healthcare of the GDP.
This is global. And that's what we are from a technology standpoint as well. We are completely Wisconsin incubated, but we are global in our reach. And so when you're thinking about those dollars and wrapping your brain around that amount of money and what's happening, it begins at that problem statement again of the fact that we're running out of healthcare providers, and we're running out of healthcare providers that have the soft skills as well as the hard skills. And those dollars continue to evolve as you look at our entire ecosystem within healthcare. So to Chris's point, we have to make sure that they're not redundant visits, that it's an ecosystem of prevention and other types of disciplines that are caregiving for our communities to help them live well.
Thank you. Jeffrey, I want to bring you in because you and I have been around a while, and I think 25 years ago we couldn't have seen this coming. Tell us from your perspective how the healthcare industry has changed and how big you see this going forward.
Yeah, so I mean, I'm just struck by how well Dr. Chris and then Karen before and now Patricia put how big this is. But one of the focuses has to be on not just outcomes, but economic delivery of those outcomes and access. And I couldn't agree more that it's got to be incorporating technology. There needs to be a human and a social touch. And that also is one of the things we hope. Well, kids can't learn in groups as socially as they used to be able to. And maybe there's a kid up in Arbor Vitae, Wisconsin, that could be the only potential physician in his grade school class or junior high school class. What we can do is provide him a social fabric and a way to connect and be both competitive, but also be collaborative and learn with others who have those same passions that they otherwise wouldn't do. And maybe that kid loves where he grew up, but would otherwise never get the opportunity to even think about becoming a physician. And then maybe that kid comes home and practices healthcare in a clinic in Arbor Vitae, Wisconsin, and does it in a better way, compassionate way in his own community as a member of that community. It can't work out better. And it is about care, but it's also about compassion and it's about quality.
Thank you, Jeffrey. Dr. Barker, can you come in and talk about, I want to ask you a nuance of this question. As you've been in, as a nurse, you've been a practicing nurse for a number of years and seen healthcare evolve. Give us from your perspective how healthcare is evolved as it relates to how big this really is. You're on mute. Go ahead.
Thank you. That's kind of a loaded question. I think first and foremost, nothing is more important than our health. And I think, unfortunately, our health has revolved around the institutions that drive our existing healthcare systems rather than being focused on sustaining well-being. Our response has always been on illness versus well-being. And I was just preparing something for our platform for the AMP Honors Program, and I was kind of struck by the fact that the CDC estimates that we have like over 130 million Americans right now that have at least one chronic disease, like heart disease, diabetes, cancer. And those numbers of people with chronic illnesses are rising steadily. And I think it's also interesting to note, and we've already touched on this, that hospital care now makes up like over a third of all of our healthcare spending in the US. And chronic illnesses are tied to more than 80% of those admissions. So while we know chronic illnesses are typically not curable, they are preventable and they can be managed. And I think that's where the focus of our healthcare system needs to change. We need more community-based programs that focus on prevention and management that can kind of level the playing field a little bit. And what I mean by that is I think that there's equity in that, in the sense that if we could have more community-based programs, it would provide opportunities for those less privileged to have access to care without having to go to the big healthcare institutions. So that kind of drives how we train and educate our medical professionals as well, is not only do they need to be medically competent with technology, but they need to have that understanding of health management and disease and injury prevention. And they also need to have that element of cultural humility, which Jeffrey just talked about. I think that's huge. And those are some of the gaps in our medical education system as we see it. And I think that our platform can definitely help bridge some of those gaps, because those are things that we really take to heart, and we have tried to incorporate those elements and those pieces into what we're sharing with students to hopefully train them in the elements and things that they need to be successful as a professional.
Wow, that was a loaded question, and you just knocked it out of the park. So thank you for adding that idea that 1/3 of Americans are struggling with or dealing and coping with chronic diseases. And I want to ask this question, and I want to start with Christopher. You mentioned prevention. And I want to go down this path because one of our sponsors of this show is the Center for Disease Control and Prevention. And it's around preventing type 2 diabetes and chronic illness, type 2 diabetes and hypertension. Can you speak of the relevancy of this platforms for actually community members themselves in that form of prevention, equity, and democratization that you so well spoke of at the beginning?
I certainly, I can try. How about that? When I think of the answers that my partners here at CV just gave, they're all outstanding. I want to make a connection that'll try and hopefully answer this point. Karen spoke about technology previously, and she talked about what Google is doing around breast cancer. I want us to think a little bit about that student or that community in Arbor Vitae that Jeff discussed, and think about the fact that we've got a vision of a doc or care provider hanging a shingle or hanging a name on a shingle right outside and practicing small town medicine. The reality is that doesn't do it. And that is a reactive approach. So we need to think about transforming that medical space. And this connection, this platform that we use, not only connects providers, but can connect community to resources that allow them world-class and cutting-edge healthcare. We can talk about the use of big data so that it's not just the 5 cases that small town doc might have seen that informs her or his care, but instead we can use a database of care and treatment plans for a disease that might be millions and millions large, so that people are getting best care. If we contrast that to what we see in the Central City, I work in the near West Side neighborhoods of Milwaukee, where we've had 6 hospitals close in the past 35, 40 years, meaning there's only 1 standing hospital to care for those patients. We need to think about how to get resources to community outside of that hospital system that Karen spoke about so effectively. So when we think about this, we've got clinicians, future clinicians, not only taking this information and using it as professionals, but using it as students, engaging with their families, engaging at community centers and other spaces where they might access CV or another platform. So when we look at this, using this information is not just about creating healthcare practitioners. It's about informing students in an early age. It's about informing families in an early age about what technology can do and about what the wellness in the health space looks like.
You know, one of the frustrations that you and I have seen is that we speak a language that, frankly, nobody understands. And if we're talking about equity, we need to take into the consideration of culture and learning from the community. How does CV Academics fit with this, Chris?
I think that, per Karen, the idea that we are putting in cultural humility training, we are putting cultural humility bent into everything that we do, is something that's been sorely lacking. I think what we've seen more recently with Black Lives Matter protests and with the realization that there are significant deficits in our institutions when it comes to culturally responsive and culturally equitable care offers us an opportunity. Because what we haven't done as a society when we're training medical professionals is get our young scientists, our young clinicians, our young practitioners to think not only about the treatment, but about who they're treating, why they're treating, and what the context they're treating in is.
Thank
And
you, Chris.
how we're able to add that in this space. And that's been really, really a central part of what it is we want to put out there.
You know, you're getting me excited about this program. And Patricia, I want to have you come in because you were giving me the verbal head nods, which I always love. But add to what Chris is saying here about the idea of culture and equity and humility.
Absolutely. So we have students, again, I'm going to go how big this is. We have students all over the globe. So we have a student that I will cite as just an example to everyone about the humility and making sure that everyone understands how cultures are very, very different. That is from Nepal. And she has been grown up, if you will, within the platform. So she is professed her interest in being a surgeon, and in their culture and what she's experiencing every day is it's really a declaration once you share what your interest is. When she was shunned by her teacher for declaring the fact that she wanted to be a surgeon, she went to us in the platform and she spoke with her support community and how important this was to her. And she felt that support so much that she did a big announcement, if you will, within the platform of how this is her second family. Her first family is right there with her, and her second family is right here within the community. And that's, again, to Jeffrey's point and Karen's point and Chris's, everyone's, that's how we grow community. We grow the community and bring everybody together. And that means your brother, your sister, it could be anyone within your community. And that is a really great testimonial of how important that is, David.
You know, you guys make this so easy for me. Jeffrey, I got to have you come back in because you started this with the idea of the human and social touch. And I want to ask it this way, because so much of what you're in an industry where you're I don't know if you consider yourself a capitalist, but the idea of you're trying to make a profit and you're not just giving the material away. Why in your industry and in industry across America, healthcare, let's stay with that, why is the human and social touch so important?
Yeah, well, capitalist maybe has a bad connotation to it. I hope, especially in the med device, just like many that go into the medical profession, they really do, and we try and keep an eye on the patient and improved outcomes or improved prevention. And Karen said it so well earlier. I literally started a company called Preventamed, not knowing what we were going to do, but looking for and setting aside money to make investments into technologies that can prevent and alleviate disease rather than chase them with late and end stage therapies. And so the compassion matters in everything we do. And how big this is, well, you think of a healthcare leader and future physicians and PAs and nurses and all of those caregivers, we consider ourselves part of that technology chain that does improve outcomes. And so CVA could provide better training for our employees. We are engaging with the healthcare leaders to apply the technologies and the information technologies that we produce. And only when our teams are more well aware of and well-rounded and well-trained can they do that efficiently, which happens to also set my company apart, because I'm going to be developing the best technologies that make the biggest difference, and I'm going to know how to collaborate with those that deliver it day to day. And so it does all kind of come full circle. And we're not just greedy capitalists back here figuring out another way we can squeeze $1 out of the system. We're trying to do what we can do to make a difference. And ironically, when you do make a difference, the dollars tend to flow back in, so you can then apply those towards your next contribution to mankind. And that's just how we think.
Jeffrey, I think that you are eloquent in your words, and I have always said, and I can own this, but I know some of your collaborators will perhaps agree with me on this. I never mind capitalism, but capitalism at the expense of people is something that we have to end. And you use some phrases, and I want to give them back to you because I think it speaks to something different. The idea of, you said the human and social touch, but you said compassion with outcomes, making a difference in contributions. And that is important to recognize, because if we had more companies like yours doing that, I think the whole world would be a better place in that idea of better health outcomes, employees that make a living wage, and that we are doing our part to think about the next generation. So thank you for that, Jeffrey. I appreciate that. Karen, I got to have you come in because, it comes back to you. You started all this, Karen, with what you were talking about before about some of the things that you're doing. Can you give us an example of how this education is working for that next generation of students?
Sure. I just wanted to add to something that Jeffrey said, because it just took me back to something that I was taught over and over and over in nursing school many, many years ago. And that is that patients don't care how much you know until they know how much you care. And we have lost sight of that in so many ways in healthcare profession, because as technology advances and it becomes more digitalized, we lose that human touch. So it's really important that we don't forget about that. And to kind of address your question here moving forward, I think some of the things that we're trying to do with our students on the platform is give them more insight into medical careers that would potentially have technology based to them, but that would be of interest to them. So for example, someone who really likes the sciences but is also really good with art might look for a career as a medical illustrator and get involved with things like virtual reality or augmented reality and things like that. We certainly want to try to keep students who are interested in public health concerns, who might also be interested in emergency medicine, for example, thinking about like a community paramedic program. So they could go on to become a paramedic, but they could be involved in public health and community service by being involved in a community paramedic program where you're bringing that element of preventative health and management right to your community, and you're avoiding those patients from having to go to their physician and to the hospital, as we talked about earlier, for some of those unnecessary admissions. So it's about bridging those gaps, but it's also about helping students understand the importance of disease and illness awareness. So we post on our site almost every day something about health and wellness. So whether it's self-care, taking care of yourself and building resiliency through this pandemic and through some difficult times, or whether it's about breast cancer awareness, whether it's about eating healthy, whether it's about exercise, just all of these things, diabetic care, hypertension, it's just bringing students to a different level of understanding and awareness so that they can take this information and use it as they move into a healthcare profession role, and be more focused on the prevention and management of some of these chronic illnesses. And hopefully we can turn it around.
Thanks, Dr. Barker. Dr. Simmons, come on in, because you and I have been friends for a long time, and I know you have a couple of next gen in your family, but you also teach the near gen. Tell me about, or tell our listeners about being a student in the year 2020, from middle through college and postgraduate. What's it like these days?
It is a year like no other, let's be honest, with what COVID has done to access, to the ability to gather, to the traditional education setting. It's different. And it's interesting because I talk to my kids about this all the time. I think there are deficits in what we have to do in terms of education based on COVID. There's not that hands-on, that communal, and that community building experience that we tend to see in classrooms. But it also presents opportunity. We in education have known for over a decade that things are moving to digital and things are moving towards a technology-based education system. This has given us a full body push into that realm. And we've had to think about what solutions look like and what improved educational process looks like as a result. Our students, while they're facing the uncertainty and some of the struggles of that, are also going to reap its benefits. I'll give you a simple example. I'm working with undergraduate students who want to become clinicians and who want to do rehabilitative exercise or performative exercise with their patients and clients. We are now offering an advanced elective at Marquette, and this is programming that we could see coming to something like CV platform for virtual coaching, virtual rehabilitation, virtual training. So what we have to be thoughtful about is where the opportunities lie to move this forward and to equip these students that might use CV with next generational skills. Our students have struggled at the outset with the transition, but what we found is that these students who've grown up with technology are incredibly resilient, oftentimes far more so than we are, and they're up to speed and ahead, and we're trying to catch up to them now.
What an awesome way to think about this. Patricia, we won't have time to talk about, we could be here for the rest of the day, and I know you all have meetings to get to. But Patricia, talk about how people might get involved with CV Academics. Tell us about how they can find you and how they can link to your materials and how they get started.
I'd be happy to. So the first is go to our website, www.cvacademics.org, and find us there and check out our advisory board and check out, we have two of our advisory board with us today, Jeffrey and Chris. So you can see the scope and the reach of our advisory board members, not only across the nation, but across the globe as far as their expertise and best practice that they bring to us. Look at what our platform looks like and go into our community and register and sign up to become part of the community. Follow us on Facebook, LinkedIn, and Twitter, as well as Instagram. Those are all ways in which we can connect with everyone. And we'd be happy to have more of our students and our community members involved. The other way is we have an extension of our advisory board called our expert panel. And our expert panel are folks that have backgrounds, whether they are students and they're up and coming young professionals, or if they are a seasoned professional of all disciplines. Again, to Karen's point, it starts with the prevention end of the healthcare continuum, and it carries all the way through end of life to our senior and our hospice care. So we have professionals from all disciplines in all of the ecosystem, again, that provide their insights and bring that to us via our expert panel. We also are emulating our own model of growing our own workforce. So we have super mentors that are growing up in their journey and their career focus and where they want to go. So they are finding those learning opportunities and the resources, and they're doing that and providing those resources right to the student as a peer-to-peer relationship. So any and all of those ways are ways that we can have our students and our community members get involved and volunteer and help us with this path and help us grow this and move this forward.
This is so exciting, and I'm so glad that we talked about the idea of equity and the idea of democratization, the healthcare industry and healthcare education. Patricia Linnaeus, Jeffrey Dienheis, Karen Barker, Christopher Simmons, thank you for coming on today. And I hope that we can do this at a greater depth at some level, perhaps look at some screens and even have one of your students come on. You know, this idea of this is a worldwide phenomenon is important, and to be able to support learning in Nepal or learning on North Avenue is something that I think all of us would appreciate. I'm your host, David Nelson, and this is the Days of Learning podcast, and we thank you for coming on the show today.
Thank you, David.
That was exciting. I'm so glad that CV Academics and the CV Foundation could come on today. They talked about this idea of more than just education and more than just access, but they talked about equity. They talked about democratization. They talked about how community members need more resources to battle diseases like type 2 diabetes and hypertension. but they also talked about the human side, to build cultural humility into education, compassion, outcomes, making a difference in the lives of people. You know, I hope that we can provide some value to those listeners who might look for resources, both in the healthcare space as well as the community space. If you like what you see on Days of Learning, drop us a line, let us know. I hope you'll subscribe and that we have some exciting guests coming on in the future. But for now, we wish you all the best. We wish you health and well-being. And from the Days of Learning team, I'm your host, David Nelson, and we thank you.